Hello, my name is Jacqueline Bland, and I am a caseworker assigned to help my client, Ms.Georgia. Ms.Georgia is a resident at an independent living facility where she has been residing for the past 2 years. Though she appears to be in great physical condition, she has started to recently develop new symptoms. She takes medications for blood pressure and moderate arthritis, but before now has not had any diagnosis of a psychological disorder. She has family that often visits her, but they live about an hour away and only visit usually on the weekends. I have diagnosed Ms.Georgia with a very progressive form of dementia called Alzheimer's disease. This disease is very severe because the brain begins to deteriorate rapidly. This causes abrupt memory loss and apathy. My client has begun to experience symptoms related to the disease, such as having memory loss and disorientation. For example, she left the front door open on one occasion in the past few weeks. Also, she called her grandson his father's name, which also exhibits the memory loss I previously mentioned. It is extremely dangerous for someone who has Alzheimer's disease to not be in a closely monitored environment. They will begin to lose many of their basic motor skills and not be able to take care of themselves in a normal way. People who have this horrific disease will begin to forget how to adequately care for themselves. Their ability to do basic things, such as bathe or dress themselves, will decline until it becomes nearly impossible. Many patients have walked into traffic or out into the woods and gotten lost. I recommend Ms.Georgia begin taking medications to combat the decline in memory loss and brain function. Also, I recommend antipsychotic medications for modest relief with agitation if she begins to increasingly exhibit signs of agitations, as long as we monitor her vitals often, as there are some side effects that are associated with these medications. I also recommend psychotherapy for herself as well as her family, and I would like to include memory aids in her treatment programs to combat the effects of memory loss. I also believe that she should be moved from an independent living facility to an assisted living facility where she can be properly monitored for her own safety.